metastasis of breast cancer. Well, it is well known that breast cancer is very easily to develop the metastasis diseases, even in a very small size. The main metastasis pathway includes local extension by invasion of the duct, fascia, bone, ribs, muscles, skins, corpus, ligament, etc. And the other very important metastatic pathway is lymphatic metastasis. The axillary lymph node is the most commonly involved part, in addition with the supraclavicular and internal femoral lymph nodes. The hematogenous metastasis is very lethal and the main cause of the death of breast cancer. The most common site is bone, lung, liver. Brain has and the brain metastasis is the most lethal. Here we show PET CT scanning indicates the supra and subclavicular lymph nodes metastasis and the sternum metastasis of breast cancer. We use the radionuclide to label the glucose to do the tumor imaging because the tumor have higher concentration of glucose. The picture showed in the lower side is the patient pre-treatment, and the upper ones showed the patients after 2 cycles of treatment, and we see the tumor, the metastasis lesion disappeared. The clinical manifestations of breast cancer, the most common manifestation is the mass. Always it's painless, solid, hard in texture, and less movable. And we can term as fixation, with skin dimpling, the nipple discharge, nipple inversion, or the orange skin, etc. And the other very important symptom is the axillary lymph nodes enlargement. It is the most common site for the metastasis of breast cancer. And the severe lymph nodes metastasis will cause the upper limb lymphedema. And the symptoms of the distant metastasis of breast cancer includes the pain, dyspnea, dizziness, and loss of weight. And this picture showed inflammatory breast cancer. And the picture in the middle showed the Paget's carcinoma of the breast. The inflammatory breast cancer is the most lethal type of breast cancer, and the 5-year survival is only 30%. There is usually no palpable mass, but diffuse changes throughout the breast parenchyma of inflammatory breast cancers. The malignant cells plug the dermal lymphatic is the pathologic hallmark of the disease and cause the orange skin and very easily to be mistaken as a mastitis. And the Paget's carcinoma of the breast, I think I mentioned a lot of times, and you should remember it's an early stage of breast cancer. The next, I'm going to introduce the TNM staging of breast cancer. It is very important because you will meet the cases of breast cancer in various of examination. The staging of breast cancer and the colorectal cancer is frequently mentioned in the examination because they are less complicated. T is for primary tumor, and just remember the 2 and the 5 centimeter. The tumor is no larger than 2, termed as T1, and non-invasive breast cancer, termed T0. T2 is the tumor larger than 2 and no larger than 5. T3, the tumor is larger than 5. As for T4, the breast cancer is local advanced, and invade the other tissues or organs, or inflammatory breast cancer. N is the most strong predictive factor of the breast cancer. And N0, there's no lymph node metastasis. And N1, 1, 2, 3 lymph nodes metastasis, axillary lymph node metastasis. N2 refers to 4 to 9 axillary lymph nodes, or the internal mammary lymph nodes metastasis. For N3, there are over 10 axillary lymph nodes and more than 1 axillary lymph node and internal mammary lymph node metastasis. For M, it refers to the metastasis. There is metastasis M1, no M0. In general, the staging of the breast is here, and most people are stage 2. I'll give you a case of, for example, a 50-year-old woman with a mass in right breast. The maximal diameter is 3 centimeters. The pathological diagnosis is invasive ductal carcinoma with 2 axillary lymph nodes metastasis. No sign of distant metastasis. The staging is T2 and 1M0, which is the 2B. So just memorize this table. Okay, this is the end of our class, and thank you for your attention. Thank you.